So I'm Joel Rosenthal, President of Carnegie Council. I want to welcome our guests and welcome all of you to our program this evening. Many of you know Carnegie Council. Some of you may be new here. We do something like 40 to 50 of these kinds of events a year. We're a very busy place. But I want to tell my good friend, Professor Jim Ketterer, this is my favorite event, and also my students who are here. This is my favorite public event, working with the BARD Globalization and International Affairs program, the BGIA program. And we've been trying to do at least one of these public events with BGIA per semester. We're delighted to have this opportunity this evening. I teach a course in BGIA, and it's called Ethics for a Connected World. And there are about a dozen people in the audience who can tell you all about that course. We had a great semester, and I'm really actually delighted that we're able to sort of finish up in this context with the rest of the BGIA program with this public event. So I'm going to turn it over to Professor Jim Ketterer, who's the director of the BGIA program. He's doing a great job. I'll tell you a little bit about the program and introduce our conversation this evening. Thank you all for coming.
Well, good evening, everyone, and it's nice to see such a full house for such an important topic. And many thanks to Joel and to everyone here at the Carnegie Council for having us back for this event, and we hope to have many more. The BARD Globalization International Affairs program is run by Bard College, as you might have guessed, and which is located in the Hudson Valley. But here in New York City, we have students come from Bard College, come from BARD's international partner institutions in Russia, in Kyrgyzstan, we hope soon from Al-Quds BARD in the Palestinian West Bank, and from BARD Berlin, as well as other colleges across the United States and from all over the world. So we have those students come to New York City to take courses from scholar practitioners like Professor Rosenthal, and also to intern at a wide variety of institutions here in the city of New York, and to enjoy their time here in the city and find interesting cultural and other sorts of things to do. One of the things that the students do as part of their study and that we open up to the public are these lectures, which are done in the name of James Chase, who was one of the co-founders of the BGIA program, was a professor at Bard, was also the editor of the World Policy Journal and the editor of Foreign Affairs, who is a generous supporter of this lecture series. So with that as background on what BGIA is and what we do, I'm very happy to turn over the stage to Professor Terry McGovern, who is a professor of population and family health at Columbia University, and María Antonieta Alcalde, who's the advocacy director for the International Planned Parenthood Federation of the Western Hemisphere. And this is one of the reasons I'm happy to see so many people here, is that this is kind of breaking new ground for us. To do a topic that's kind of like this, too many, I think, of our lectures have been focused on kind of a narrow gauge and a narrow definition of what we mean by foreign policy and what we mean by international affairs. So to take a hard look at issues of reproductive health, how they're affected by U.S. foreign assistance, and perhaps changes in U.S. foreign assistance that might be coming up, I think is an important thing for us to do, and I hope this is the beginning of many more lectures that we're going to have on topics like this. So with that, I turn it over to our guests.
Thank you very much, and thank you very much for having us here. It's a real pleasure, and especially sharing the stage with Terry, that is also a very dear friend of mine. So I mean, my first question to you, Terry, is that, I mean, the issue of sexual and reproductive rights, women's rights, is not a new issue. I mean, we have the CEDAW Convention, and we have 4 conferences on women's rights, International Conference on Women's Rights, and still we have I mean, like not fulfill those commitments. Still, in sub-Saharan Africa, for example, 50% of the infections, the new infections on HIV/AIDS are young women. In the region that I work the most, in Latin America and the Caribbean, even though a lot of advancements have been made on sexual and reproductive rights, still 20% of all the deliveries of the births are from women under 18 years old. And well, if we see the Millennium Development Goals, the governments they haven't been fulfilled MDG 5 that it's on women's health. So what's your perspective on that? Why is this happening?
That's quite a question, but first of all, thank you for having us here. Thank you to the BARD and the Carnegie Council, and we have been partners in advocacy for many years, so it's great to be on the stage with you as well. I think if you look at kind of the trajectory of global reproductive health, you see that unfortunately there is still a lack of kind of availability of contraception in many places, still at a 24% level in sub-Saharan Africa. You see violence against girls and women is at epidemic proportions. It's been that way a long time. You see lots of problems with laws that keep girls, adolescents, from being able to access contraception, say no to early marriage, lots of power issues between girls and young men that keep girls from being able to kind of exercise their sexual and reproductive health and rights. I think one of the things that has evolved over time, we've had these amazing activists and advocates who've gotten things like CEDAW, the Convention on the Rights of the Child, all of these different kind of global systems that say, you can't do certain things. You have to allow adolescent girls to access contraception. You have to allow girls to choose marriage or not. And what has evolved over time is countries have figured out ways to evade those commitments. So in the case of the kind of the Convention on the Rights of the Child, CEDAW, most of the international human rights commitments, what happens is a lot of countries take reservations around issues of sexual and reproductive health, i.e. we agree to CEDAW, but we take reservation to the section that deals with access to contraception, freedom of choice in all of these areas. So that's one way you might actually see that a country has ratified all of the relevant treaties, but then you wonder why there's really high maternal mortality rates or lack of access to contraception. If you look closer, you'll see they ratified the treaties with reservations. Another part of this process is that if you ratify a treaty, you actually have to domesticate it and make it national law. So in some instances, they never do that. In some instances, they domesticate it with exceptions for private law. And I always like to say, Eleanor Roosevelt said, human rights need to attach in the smallest of places, right? So they've found, a lot of countries, member states have found ways to evade these commitments. So those are the those commitments, but the Millennium Development Goals, of course, governments agree to these things, but there's no teeth to enforce what they've agreed to. And as you pointed out, the agreements were quite basic around sexual and reproductive health. They weren't particularly sophisticated in measuring any of these issues: law, structural barriers, economic justice, et cetera.
And I think that in a way, the MDGs just expired last year, and now we have a new set of commitments, the Sustainable Development Goals, that are way broader. From the 8 commitments that we had with the MDGs, now we have 17, and we have stronger language. We have, SDG 3.7 that says universal access to sexual and reproductive health and reproductive rights. So we have rights there. We have on SDG 5, gender equality and reproductive rights. Do you have more hope for the SDGs? Do you think that with these commitments, we will be able to advance the women's agenda further?
So, I think that the advocacy community, including you, did an amazing job in advocating for the Sustainable Development Goals to be broader, to have gender integrated all over the place, to have targets that are more sophisticated, that take apart. The MDGs measured the top line of how a country was doing. They never looked at inequalities within a country. So we've made a lot of progress on the Sustainable Development Goals, at least in the formulation. I will say that Columbia University, we were brought in to do the methodology around 5.62. Sorry to be so technical, but
I know what she's talking about.
you know what I'm talking about. So that's the Sustainable Development Goal that is for the first time to measure number of countries that have laws that guarantee access to sexual and reproductive health. Very important, right? But immediately, these have to be negotiated by member states, right? So are you going to ask questions about abortion? Are you going to ask questions about unmarried adolescent girls' ability to consent? Are you going to ask questions about third parties' ability to make decisions for women in certain countries? And so, we went in originally and we kind of took ICPD, which is the broadest kind of international agreement on sexual and reproductive health, and asked questions that matched each section of it. And the UN was like, we can never give this many questions to the countries, right? So there are questions. This is ultimately a political situation, right? The countries have to agree. And then who fills out these questions at the country level is another big question, right? So how do you guarantee that it's reliable? How do you guarantee that it's valid? We have these surveys, and so they're helpful, but I think we really have to go much deeper in looking at what's really going on in a lot of these contexts. So yes, I think they're an improvement, but I think they're going to have to be carefully watched.
Yeah, and one of the challenges, as you were mentioning, is political will. At the end, I think that we have, and I mean, you out me with this audience, and I participated really closely in the process of the development of the SDGs, and I have to say, it's not only the SDGs, on health, that is SDG 3 or 5, like gender equality, for the first time in history, we have a goal on inequalities, that SDG 10, that is to reduce inequalities within countries, but as you were saying, Terry, among countries, and to think how can we build a more equal world. But at the end, it's come back to the national level and to ensure that we have political will at the national level. And talking about the national level, I think that it's impossible to have this conversation without talking about the big elephant in the room, and that's the results of the U.S. elections. And I really would like to have your input in terms of how do you feel that, I think that I just will take for granted that globally women's rights and sexual and reproductive rights will be affected by the results of the elections. But what's your take on how much it will be affected? What's your perspective of that?
Okay, so since the U.S. is a part of the globe, let me start with the impact in the U.S. Now, we've had I think 288 restrictions introduced at the state level on abortion. We have, the president-elect is very clear that he wants to see Planned Parenthood defunded, and there's lots of data that shows that Planned Parenthood really works with low-income women of color, communities of color. So there are some big problems in the U.S. to begin with, and of course, part of the platform was to overturn Roe v. Wade, and that could happen either by, they pass a law that is, basically going to gut Roe v. Wade, or it can happen based on one of these state restriction cases. And of course, the question is how many Supreme Court justices will turn over. So I just have to say, in the context in the US, where we have a shockingly high maternal mortality rate, where we've seen some progress in reduction of teen pregnancy because of access, I'm very worried about the situation here. But in terms of foreign assistance, there's many faceted potential impact. We can't say, what President-elect Trump said was that he would reinstate the Mexico City, otherwise known as the abortion gag rule, which is that any organization getting U.S. assistance, U.S. aid, cannot even counsel or make referrals about abortions or they lose their funding. Now, this is a policy that has come and gone with different administrations. It was repealed in the last administration, but there's lots of evidence that shows that that actually just leads to a whole lot of unsafe abortion, more pregnancy, because you're cutting down, you're shutting down services that are really promoting health. So that's one thing. Another thing is that we see these kind of requirements of programming around abstinence and whether you can talk about sexuality, whether you can't talk about sexuality, how much you'll touch law issues. All of these things are actually impacted by the kind of political viewpoint of the leadership. Now, so that also goes to the UN. In effect, the US, because we're such a huge donor, we pretty much help select the head of UNICEF. That's where the Convention on the Rights of the Child and all the adolescent issues sit. We are a major donor of UNFPA, which is the agency, the global agency looking at sexual and reproductive health. You know, you can go down the list. I think people don't really know yet, but there could be profound impacts on global health. And just quickly to say one other thing is the whole issue of conflict, right? We at Columbia have a huge forced migration program, and we look a lot at sexual and reproductive health of you know, women in forced migration situations, and that is already so tenuous, the lack of services. There's no abortion services. There's very little access to justice in the context of sexual violence. So the imposition of more restrictions in this area is really, to me, very, very sad.
Yeah, and I think that like we're living a very kind of scary time in terms of like what's ahead of us, because this is I mean, you were mentioning the global gag rule, and for me is the U.S. has been, I mean, in general, like an important donor on family planning. I mean, like still, I mean, even during the Bush administration, the U.S. was like providing, I think right now it's around 40% of the international funding for family planning. So there are like some countries and some organizations that without the U.S. support wouldn't be able to provide basic services, like delivery services and like a family planning services. And what is like a very devastating about the global gag rule is that it prohibits organizations to provide any, I mean, to do any work related with abortion, not only with the U.S. money, but with any resources that they have. So if 90% of your budget is from other sources and 10% is U.S., then you cannot do anything. And that anything is not even services, it's information, is referrals, and that. So that really creates a big problem for organizations that are aware, and IPPF, International Planned Parenthood, like we're one of those organizations that we have clinics in the field and we're aware. Yeah. And then we are kind of torn in the middle between knowing the needs of women and having to respond to the needs of women in the field. And some of those needs is abortion services or abortion counseling, and having to refuse that service, and it's like, well, it is just a problem. I cannot even give you information about it, or losing an important donor. And I think it's a choice. It's like Sophie's choice in terms of like what to do as an organization. And so I think it is a very kind of like the scenario that it looks with the U.S. And as you said, it's a prominent player in the field.
I think also where abortion is legal, it's safe. Where it's illegal, it's unsafe. And I mean, I think people maybe don't realize that 50% of the deaths related to abortion are in young women, women younger than 25. So there's devastating impacts on all of this to young people, not just young people, but that is pretty prominent.
And as you said, it's not only abortion, it's like what we know that prevents abortion, and we know it, is comprehensive sexuality education and access to family planning. And the problem is that like the conservative groups, and including like what it seems to be, what it will be the next U.S. government, is not just having very, very regressive policies on abortion. It's having regressive policies in the things that we know can actually prevent abortion. It's like having abstinence-only programs and denying women access to contraceptives or emergency contraceptives, among all. So then we will increase the number of women that then will need access to some services that we won't be able to provide. So that's very scary. But given that I want to have some time to open questions, I don't want to like end up like this initial conversation with in a sad note. So I would, or in a dooming feeling. So like I would like to ask you, within scenario, do you have hopes? Do you have like, do you see some lights in terms of like of hope in terms of like sexual and reproductive health and rights, women's rights?
I mean, I think so. In the last 20 years, we've seen like a you know, almost a huge 50% decrease in maternal mortality around the world. We've seen an uptake on, you know, contraceptive availability. We've seen safer abortion in more places. So there are some, you know, there are some improvements for sure. I guess what gives me the most kind of hope is kind of working with young women around the world. I mean, there's activism all over the place, and whatever shock and dismay some people may be feeling here about some of this, people are certainly feeling and organizing around the world. I think I always like to say that when I first became a lawyer, I worked as a lawyer doing legal work with ACT UP. And Reagan was president, and all these young men were dying of AIDS, and they taught me about creative resistance and joyful creative resistance. And I think we're going to have to start thinking about, you know, kind of strategies that are a little bit different than we've used in the past. I mean, we're in kind of a, you know, a whole new landscape. But I do really take a lot of inspiration from what I see in the field.
I fully agree with you. I mean, like, I have the privilege of working with a lot of young people, I mean, globally and in Latin America and the Caribbean. And you're right. I think that this struggle and this setback is like really bringing together large number of people, like marching in the streets here in the U.S., but also, I mean, overseas, like trying to think about how to ensure that their values and their perspectives really prevail. And I think that as a movement, it's in these moments of struggle when we, I mean, get together and work through our differences and really strengthen. So I think this is, although, I mean, it could be very challenging, we're seeing it as also as an opportunity to bring new voices and to have the opportunity to, I mean, to listen to people and to incorporate their concerns to our work. So talking about listening to people,
Yes.
I would like to open the floor to the participants. So there are two mics. If you can go to the mic. There are two mics over there, so if you can introduce yourself and ask your question. Do you want the mic go to you? Or? Yeah. Thank you.
It seems like
What's your name?
Austin.
No.
So I kind of got out of this talk so far that the opposition, at least to some of the advocacy that you've been doing, seem to be, I guess, conservative governments in our country and the men in power in sub-Saharan Africa, I guess. And so I was just wondering, how do you deal with, I guess, people that feel that their religion, I guess, is the driving force behind why they're fighting against abortion or why they're advocating for, I guess, gender inequality, and they're not accepting of consent maybe for young women, and kind of hide behind, or not hide, but like use that as the driving force and not necessarily you know, in like their independent ideological beliefs?
It's a very good question. Maybe we can take. So
Do you want to go first? Or I'll
Sure.
Yeah, either.
No, I think that like within all the religions, I think that we see voices claiming for women's rights and gender equality. And of course, there is a spectrum, and you see within those spectrums like more conservative voices. But like even I'm from Latin America, and I think I already said a couple of times. And the Catholic Church is very strong in Latin America, and the Catholics' values are really strong. But within that, within the religion, like there are priests and there are nuns that are claiming for gender equality. And I think that what we have trying to do, and we as IPPF work closely with a lot of faith-based organizations that care about health, that have been working with HIV patients, knowing that maybe they don't agree with some of the like living styles of the gay community, but that they are there to help them. So I think that there are like certain values that we all share I mean, within the religious community and within the sexual and reproductive rights community in terms of caring for the well-being of people. So with the communities that we work with, like faith communities, we use those values to create common ground, knowing that we may not agree on everything, but working on the issues that we agreed on. I think that they are like a more extremist voices, and it's hard to make a kind of common ground with them. But I feel that if we work with those people, that the vast majority are really the ones that care about the well-being of people and are willing to work in that common ground. So that's the way that we approach it, and that's the way that we do it.
Yeah, you know, there's some really, I think, absolutely, but there's also some very interesting work going on around culture and women and girls' right to participate in culture. So there's Farida Shahid from Pakistan and Sylvia Tamale from Uganda are very much taking on what they call the patriarchal version of what culture is. And they are using all kinds of techniques like, you know, kind of unearthing history, versions where women had different roles. And they're actually challenging what they're saying is the patriarchal interpretation of culture. So it's kind of this movement to the right to participate and make culture, whether you're a girl or you're LGBT or whatever, which I find really, really interesting, because it's always been kind of culture versus rights oppositionalized, but they're interrogating who owns culture.
Thank you. Any other questions?
Well, I just want to say thank you again for being here tonight. I'm Olivia. I'm with the BGIA program. And I suppose the question is about the advocacy piece and how in certain societies it's dangerous to be an advocate. You know, you're putting your life at risk. And how, like, International Planned Parenthood, for instance, would empower and support women and advocates to pursue their agenda in a safe way, and what that might look like for instance, in certain regions of Central America, you know, how that changes country to country, and what are some of the methods that like IPP would suggest, for instance.
I think that like that's a very good question, and that's something that like we are very concerned of, like as part of the human rights movement. And being a human rights activist is very dangerous. Being a women's rights activist, being a gay activist, being working on climate change of environment. Like I think that every point where there's someone fighting out there, and that that struggle is kind of jeopardizing the interest of the powerful, the wealthy, and that's a point when people could be in danger. And so the way that that we approach it in terms of like and this is a huge diverse group. Like I was a youth activist a long time ago, and for example, within the small group that I was working on, we did a lot of like self defense, but not only physical defense, like training as part of being part of the activists, like not only training, but also kind of like space, a safe space in terms of like, how do you react when like suddenly you are in an event and people start shouting horrible things at you, if like you're murdered or if you are slut or like, so how can you hold on that? So I think that the type of violence that human rights activists and gender equality activists face is very broad. There are like several programs, as I said, like in terms of like helping you to cope with this. Like we are a very tight community too, so most of the time it's not that there is one person out there, it's an organization that is supported, there is an international community, and there is a sense, I think now with internet and with social media, there is also a sense of protection in terms of we just had a case in Nicaragua where during a march on September 28th that is for abortion legalization, a group of women were taken by police and were took we didn't know about them, and suddenly a whole change of social media was responded, and in the matter of minutes, I think we all received messages. Everyone started mobilizing, people who knew people in Nicaragua, making phone calls, and they were released. So I think that we don't have just one program for protection, and I have to say that it is very important that we raise the cases. We just had a case in Honduras in the case of Berta, that it was murder. So it is important that we know about it, that we are part of this network of protection of human rights defenders, and that we raise those cases, because honestly, it is impossible to keep them safe unless we keep them visible.
Thank you.
Hi, my name is Sydney. Thank you both for being here. So my question is kind of related to the fact that I think the U.S. is very well known for typically being, a fairly progressive country, and I think it's really interesting how when you look at reproductive health care, especially in the U.S., access is kind of becoming dependent on a woman's zip code, and access in New York is very different from access in other states. And I'm very lucky to be a resident of New York, but when you go to states like Alabama or Mississippi or Louisiana that currently only have one abortion clinic, it's almost like another world. So my question for you guys is, how does that compare when you look at those specific states or other states like Texas or Ohio that are currently in the news for very restrictive laws being passed there? How does that compare to the work that you do like in Latin America or Sub-Saharan Africa?
I mean, it's frankly very similar. First, many countries around the world, abortion is illegal, right? 2/3, I think, of countries in Africa and Asia. So we're talking, very similar situations. I think, all kinds of, I think we'll find that the spike in maternal mortality has to do also with lack of access to abortion in places. People have to travel great distances. People are doing things that are unsafe. There's a perception that you can use other methods, but you still need to have some form of supervision in using other methods. So to me, it's very similar, and I've actually worked a lot in the U.S. South.
I think it is very interesting because about this perception about the U.S., and I may be very politically incorrect here, but when I moved to the U.S., I honestly, I was very, and I live in Brooklyn, but I was very surprised to see how, this idea of the really progressive country, it's not really it. Again, it depends on where you live, but if you see, for example, that things that we're fighting for, or that in many countries, or things that we have already achieved in most of the countries in the world. Most of the countries in the world already that ratify CEDAW, for example. Not the U.S. Like the CEDAW protocol, we're aiming for that. Not the Convention of the Elimination of All Forms of Discrimination Against Women, and not the U.S. When it comes to inequalities, these countries, one of the most unequal countries in the world. When it comes to teenage pregnancy, in many countries we're really aiming to reduce teenage pregnancy. Teenage pregnancy in the U.S. is going in the high, when most of the countries is really reducing. And if you see, the sexuality education programs in schools. It's some of the ones that some countries like in Latin America have stopped using in the 70s because they knew that it were not working. So I think that many times under these kind of mask of you were like in the front of the world with super progressive, this is hiding all the inequalities, all the regressions that are really in the US. And I think it is really important to show it. It's really important for American people to point at those inequalities. And again, like I've been very involved in the Sustainable Development Goals, so I'm biased. But I think that like the Sustainable Development Goals, in a way, it gives you an opportunity because different from the Millennium Development Goals, the MDGs were an agenda that was kind of funded by the North and implemented in the South. It was a like poverty reduction agenda, mostly with this idea. One of the big negotiation points when the SDGs were being negotiated was like to say, this is a universal agenda that needs to be implemented everywhere. And every country must come back to that stage of the UN and report on what they're doing to reduce maternal mortality, to reduce poverty, and that gives everyone, especially the countries in the North like the US, for civil society to go and tell your government, so what are you doing to reduce SDG 10, inequalities? What are you doing to reduce inequalities in the US? What are you doing to reduce maternal mortality in the US? And I think it's a possibility to bring to an international forum the reality of the US that is, as you were saying, a very uneven reality. So I think that's a very good question, and you have an opportunity, I think like American people have an opportunity to use that stage to really out or like make more visible the reality in the US.
Even that question I was working on, do we have laws that guarantee access to sexual and reproductive health? Do we? What's your definition of sexual and reproductive health? Is abortion in it? Does it exist for girls 15 and above, right? I mean, you'd really have to answer that question, probably no, if you look at the majority of states and you include abortion. So.
Yeah, not even like, I mean, just to continue, like, I remember, like, I mean, during the discussions on like the inclusion or not of contraceptives on the insurance, I was already living here. And I was surprised. I was like completely shocked. And I'm Mexican. In Mexico, we have like a different type of system. We have Social Security, so like, I mean, the government provides a lot of services. And contraceptives are free for everyone. Like you go to the clinic, it's a system that, like in many countries, like the social systems are in crisis, they have a lot of needs, like they are underfunded and that. But one discussion that we are not having is if women have the right to access contraception. There are other many discussions, but that discussion, so I was very surprised how strong and violent and like the question about access to contraceptives was. And again, it's like how the most progressive country in the world is having this discussion when we have had access to free contraceptives for everyone, even people under 18 for free since, I don't know, the 80s. So, yeah.
Hello, my name is Sofia Villalon. So a lot of this topic is very familiar with the UN. And there has been topic around the Security Council being ratified or reformed. So that begs the question of CEDAW and the UN, and then you have the 5 permanent members that hold the veto power, and the US is one of them. It kind of just baffles me that what you just said, that Mexico, it has this has programs available just readily. US, very progressive, and they hold this veto power. I know you said that maintaining that activism is very important. What else can we do besides just, marching on the street, something that's loud, something that's proud, something that says we want change in the United States, not only like in progressive, liberal type of states, but also everywhere in the country, like abroad, everything that encompasses global women's rights, global reproductive rights.
Well, I mean, I think I work at a school of public health, so we're trying to actually make a plan right now to measure impacts, immediate impacts of some of the things that we're afraid are about to happen. It's very important to actually show what has happened. Now, some people say we're now living in a post-fact world. We're not giving up yet on that. So we need to measure actually what these changes are going to cost in terms of human lives. I do think you're raising, though, a very important issue, which is, the limitations of the UN system when it's kind of built upon member state agreement, right, and negotiation. I think it is a really important discussion to be having. What are the limitations of the UN, given that so many member states may not be representing the people in their country when they're doing what they do at the UN. So.
I think that, for me, the UN, it's a system, that has been reforming, I think, since the second day that it was created. It has been it's going through different reforms, the Security Council, ECOSOC, because I think people recognize that it's an institution with flaws, with the necessity of, with a huge mandate, human rights, social development, economic development, security, etc. But, and knowing that, I have to say, but it's the only one. It's the best institution because it's the one that we have. And I, again, like living in the US, I have been very concerned about the conversation about the UN and how young people in the US is not we don't believe in the UN, it's not useful, we can police the world ourselves, why do we need to, I'm really concerned about that because the UN, even with those, and I agree, having 5 countries that have all this power, it's really dangerous. Even without, it's an institution that helps us to have those global conversations, bring together, it's a forum for smaller countries to really amplify their voices. It's a forum for civil society to bring our own voices. So I think that we need to talk about reforming the UN and those type of things without, throwing the baby with the water, so because it is important to protect it. And in the sense of what can we do in terms of mobilization, I think that this, as I was saying before, we have at least 4 years of of a strong struggle. And this is the time to be creative, and we are relating on you, on the younger generation, to let us know creative ways. Right now, I think as the time is passed, I think that right now we're all yeah, what will happen, and kind of excited and do something. We're gonna get tired, and I've been doing international advocacy for a while, and I have to do UN work during the Bush era. And it was amazing how, the first year, the second years, a lot of people were coming, and the sense. And then the last year, the last maybe 3 or 4 years, it was maybe 2 of us sitting in the basement of the UN, holding the ground, because you get tired of losing. Of not winning. That it's kind of so. So I think it is important that we maintain the spaces, the communications, that we are informed, and even if we cannot fully advance the agenda, we would like that we hold ground. And as I was saying, we are really relying on younger generations to come up with bright and funny ideas on how to communicate our message and how to mobilize people, because at the end, that's what we need. Thank you.
Thank you so much.
So I kind of have 2 questions, and they kind of go together. The first is that if the policies that we were talking about that we're afraid in the upcoming with Trump's presidency, if they actually end up being followed through on, who ends up taking that position of leadership in reproductive health? If America suddenly stops funding every organization that supports abortion. And then the other part of the question is, especially if these policies change so often as when we elect a new president, what are some ways that we can stabilize our progress?
Yeah, I mean, I want to point out that PEPFAR, which is the big HIV initiative, was created under a Republican administration, right? So not everything goes. There are, you know, unfortunately, abortion is always in the crosshairs. Family planning, I would say, does better. So you can see certain components of the sexual and reproductive health kind of exist and go on in Republican times and Democratic times. It's the abortion issue, and I think to answer, you know, a lot of other donors try to step in and cover. A lot of private donors try to step in and cover. In fact, there is a lot of private donors' involvement in the whole issue of providing contraceptive coverage, et cetera. But I also think that, you know, there's lots of people trying to make inroads and so that there's some stability around some of these programs. So I think people are still hoping that everything won't just go. And to go back to the point about the UN, I mean, you know, the UN was created after World War II to, you know, kind of elevate human dignity and prevent preventable suffering. So the UN has to, even in the face of member states that actually want to violate human rights, has to, you know, stand the ground. And so we have a lot of agencies that actually know all about these issues, and they're not able to implement them on the ground, but they know what they are. And I think we'll work to try to prevent complete and total disaster in this whole area. Because ultimately, you could do an economic analysis of, you know, an investment analysis of why you don't want to stop providing this support in the world. There's lots of reasons to do it. So.
Yeah, no, I think that when George Bush Jr. took the presidency, he reinstalled the policy, the global gag rule. And then the Europeans, the countries got together and they created what was called at the time the decency fund. So it was like really to cover that gap, like especially right now, like, I mean, looking at the landscape, it doesn't look that like the Europeans. I mean, like with the refugee crisis and the ODA crisis, that's going to happen. But I think that people's already thinking between some big individual donors, private foundations will do that. But at the end, many organizations will have to take the gag rule and will continue providing family planning services and HIV services, but not abortion services. So at the end, who's going to pay the bill is like the vulnerable women that don't have access to services, I mean, like to abortion. And here it comes again, like the issue of inequalities. It's not the wealthy women who will suffer. It's like, I mean, because if you have the means, you can pay an abortion. And in any country, even in the countries that has, I mean, like Latin America has the country with the countries with the most restriction on abortion. We have the countries, there are 5 countries in the world that fully ban abortion, even when the health of the women, with the life of the women is in danger. So even if you're having an ectopic pregnancy and your fallopian tube will explode if you don't have an abortion, the doctor cannot intervene. And those are Nicaragua, El Salvador, Dominican Republic, Honduras. Chile, Honduras, well, and there's like 6th one, the Vatican, but they don't have women, so they don't have that problem. So like the rest of the countries in the world, well, they do have women, sorry, but they don't get pregnant. Well, they do get pregnant, but that's another story. The other countries have a certain means to have access to abortion. So in countries that have, like in Chile, in El Salvador, in Nicaragua, if you have money, you can have access to an abortion. And that's why abortion is, I mean, although we talked about it as a reproductive rights issue, but it's a gender, I mean, it's a justice issue. It's a in general, I think, and also it's a development issue. Like, I mean, if women cannot access contraceptives, if women, if we have high maternal mortality, at the end, the economics suffer. I mean, like if you have a big part of your of your work labor who's not even, like, when you're not able to participate in that. So I think that, I mean, who's gonna pay for this? In terms of who's gonna cover, like, the gap? We hope that, like, some private foundations and some governments will do that, but at the end, who's gonna pay for it is women, for sure. We have like 3 minutes, and we have a question up there.
Vincent McGee. I have a comment and then a question. One of the things that we have to focus on more and more going forward is that we have to find ways to have these conversations at home, not only in New York City or at school or in our workplaces, but if we learned anything from this election, is that many of us are out of touch with what a majority, for whatever reason, voted. And we have to think about that. Look at the history of gender and sexual diversity. AIDS was a scourge, but it created the opportunity and it forced people to talk about sexuality, and it changed a lot of thinking. So we need to find opportunities and to remind people that reproductive health isn't only about abortion, although abortion is a key point. Another thing is to have simple statistics that can open the door to conversations. In reading all of the coverage about Fidel Castro's death, there was almost no mention of the positive health situation and structures in Cuba, and the fact, I think I'm correct, that Cuba has about the lowest infant mortality and maternal mortality rates in the world, and the highest literacy rates in the world, higher than the US. And we have to find ways to look for those kind of statistics and to bring them not in people's face, but into the conversation in a way that opens possibility of change, of opinions and activation. Thank you.
Thank you very
Yeah,
much.
totally agree.
Yeah, and I think that, like, the thing about conversation for me is very powerful. I mean, we were discussing, like, on the question that Osi mentioned in terms of, like, people that for any reason do not believe like us. And I think that engaging in conversation is important, and not only talking to the people that will agree with you, but, like, engaging in an open conversation to understand the value. I mean, many times, and I think that, like, the Trump, like the results of the U.S. elections is one opportunity. I mean, we can just take it as, I mean, we're right, we're superior because we're smarter, and you made a mistake because you're ignorant and you don't know what you're doing. Or we can try to engage and to try to understand what are the values and what are the principles and why why so many people decided that this was the best thing. And I think that we need to engage into those conversations and find the common ground and try to, I've been talking a lot like a kind of a foreign person who moved to the US, but I've been really surprised to see how the abortion discussion, I think that there is no country in the world where the abortion conversation is so polarized like in the US. I mean, like, I haven't seen in other countries doctors being murdered because they perform abortions. Like, I mean, so I think that, like, finding common ground, finding dialogue, I think it is important, although it's hard. And also, like, I mean, as you said, like, I mean, looking at the good cases, at the good outcomes, like in the case of Cuba, like zero maternal mortality for abortion. In the case of Uruguay, that, like, decriminalized abortion a couple of years ago, zero maternal mortality due to unsafe abortion, what is huge. And also, one final note, like, sexual and reproductive health and rights, it's not only about abortion. There are other many things. Access to contraceptives is still an issue. Fistula, sexual transmitted infections, HIV. There are many things. And at the end, what we're talking about is about people being able to make decisions about the most basic and fundamental elements of life: who you love, and who do you want to be. So these are like, these are like who, if you want to have kids or not, and when do you have it. These are like really fundamental things, and it shouldn't be a privilege to be able to make these decisions. And right now, the world as it is a privilege. And so at the end, it's a social justice issue. So do you want to have some final
No, I
words?
totally agree. I mean, I do think, we need to really kind of reset and think about how we talk in our conversations, but also how in this election certain issues were just kind of, the whole sexual and reproductive health issue was collapsed around abortion. And there are real health outcomes that are linked to all kinds of health outcomes, to closing, to defunding Planned Parenthood, for example. So I think we really have to take back the discussion and have it in many more places, and also publicize exactly how bad the health outcomes are in this country around these issues comparatively. So.
Well, thank you very much. I think that we need to
Thank
close
you.
that. Thank you.
Thank you.